Now that we've reviewed all these natural remedies, I'm going to discuss how to use them strategically in potential combinations. I do want to offer some words of caution. As I've said before, these remedies reviewed here are relatively understudied. More research needs to be done before we can recommend them with more certainty. The efficacy of these treatments may vary between conditions. We do need to learn more about the safety of these remedies as well as their interactions or potential interactions with other medications. Combination therapy should always be considered as a viable strategy if monotherapy proves ineffective. There have been some reports in which different natural remedies were successfully combined with registered medications. For example, omega-3 fatty acids and SAMe, S-adenosylmethionine, have both been successfully combined with standard antidepressants for treatment-resistant depression. Ginkgo has been successfully combined with donepezil for dementia, primarily of the Alzheimer type. The main caveat about using ginkgo is that certain individuals taking anticoagulants or who are about to have surgery should discontinue ginkgo because ginkgo inhibits platelet activating factor and may increase the risk of bleeding. Other strategies include combining melatonin or valerian with benzodiazepines for cases of more severe anxiety and insomnia. Other examples include combining inositol with clonazepam for refractory panic attacks. Ginkgo or maca root can be combined with standard antidepressants. In cases of antidepressant-induced sexual dysfunction, NAC could be combined with standard mood stabilizers in cases of bipolar mania that doesn't respond to mood stabilizers alone. So let's talk a little bit about all natural combinations. What happens if you have a patient with comorbidity who is very much set on wanting a purely natural regimen? Well, some speculative strategies can include combining St. John's wort with valerian or melatonin for depression with insomnia. There are actually some reports of this that show success. St. John's wort could be combined with kava for depression with generalized anxiety. Kava should be used with caution because there have been reports of liver problems occurring. What else? Omega-3 and SAMe could be combined together for refractory depression. And SAMe or omega-3 could be combined with inositol for bipolar depression. But remember, in cases of bipolar illness, when you're looking to prevent mania, probably the safest strategy is to use a registered mood stabilizer. But these are approaches that you can take in certain carefully selected patients. Having mentioned St. John's wort, I do want to issue a warning about it. Combining St. John's wort with other drugs can be tricky because it can interact with many other medications, primarily via induction of cytochrome P3A4. This can result in reduced activity of several drugs: warfarin, cyclosporin, birth control pills, some of the anti-HIV drugs, zolpidem, and olanzapine, among others. Another important caveat about St. John's wort, it should not be combined with serotonergic drugs such as the SSRIs because St. John's wort contains some mild monoamine oxidase inhibitor activity. The interactions with serotonergic drugs have been reported to cause serotonin syndrome in some patients. So the take-home point here is be very cautious with St. John's wort in patients who have medical comorbidities such as HIV, cancer, or who are status post-transplants, or who are taking multiple medications. Let me summarize this section with 3 key points. When a patient does not respond to a single medication, combination therapy can be attempted. Many of the natural remedies discussed here can be combined with each other in order to target comorbid conditions such as depression with anxiety or other combinations of illnesses. Caution should always be exercised if you're trying to combine St. John's wort with other medications because it may have several potentially very serious interactions with other drugs.